Hello and welcome to the first Snapscale, how to hire, train, and retain effective virtual assistants while ensuring HIPAA compliance and data protection. I'm your host, Nathan Bush, and welcome to the Snapscale webinar. I really appreciate you guys taking time out of your day. I know that as a physician, as a clinician, you're busy, and I appreciate you joining healthcare HIPAA-compliant virtual VA webinar that we've done online as Snapscale, formerly BBC Global Services. I'm a Senior Vice President of Outreach and Marketing, and I wanted to introduce our CEO, Mike Yablonowitz. Mike, thanks for taking time to meet with us. And wow, exciting news, transition to Snapscale.
Yes, it is, Nathan. It's been a long time coming. We are very excited about it. New name, new branding, same service, all good quality. But again, as you said, my name is Mike Yablonowitz. I am the CEO of Snapscale, formerly BBC Global Services. And I am really excited about this webinar that we are doing because at the end of the day, we can all agree that finding and retaining great people is a challenge. It's not that people don't want to work. We all have to work. But the staying power of employees these days, we've all seen, has diminished. And the sense of family within a company isn't like what it used to be. Some people argue that it's a generational issue, that younger workers don't have the same work ethic. As a Gen Xer myself, I remember always coming in early and staying until my boss left. And usually I used to wait until his car left. That's an aside. And also, we always asked, is there more that we can do? Is there better things that we could do? Is there more that we can help? And today, the perception is that many job seekers are focusing more on benefits, vacation time, and flexibility. Some people argue that's a positive. But on the other hand, companies, right, aren't necessarily the same way they were in my parents' generation. Where you'd stay for 40 years and retire with a pension and maybe even get a Rolex depending on what you were doing. And the joke was that if you had a good job, you had a company car. If you were white collar, I know that's not for everybody, but it's just a perception here. So at the end of the day, it doesn't matter what's right, what's wrong. The truth is the landscape has changed. We all agree. That's why we're here and we're talking and you're here. And businesses are struggling now more than ever to find and retain reliable, dedicated, and capable people for their clinics. As a result of this, many business owners are looking elsewhere to fill, these critical positions. And what we've seen time and time again is that offshore talent, if managed properly through the entire life cycle of the staff, the staff has the needed integrity and commitment to do these roles, which is why our businesses have been so successful through this change. We have many clients that come to us. Quick story is we had a doctor just the other day that called me and said that they were sick and tired of all the turnover in their clinic, and they heard that we can find HIPAA compliant staff, and when we went back and forth about it and the challenges and finding out what they had, what the issue was, and how we were going to solve it, he turned to me, smiled, and he said, it's not a matter of the money. It's not a matter of the cost of the person. It's a matter of the turnover that's costing them time and headache. And he said, if I could just find people to come in every day, I would pay them top dollar. It's really that consistency that he came to us for, and the continuity that he came to us for. So, and also at the end of the day, hiring, great talent is just the beginning of it, right? Like true success lies in finding, motivating, training, and effectively managing that team so they fully grasp the nuances of your business and remain engaged. The goal is to create continuity, as I said before, avoiding the endless cycle of hiring and turnover, which is exactly what that doctor was telling me about the other day. And by doing so, you build a team that seamlessly integrates into your company's culture and at a fraction of the cost, and without the complexity of HR management. And that's what everybody's looking for. And that's exactly what Snapscale's managed HIPAA-compliant outsourced staffing service provides. We're leveling the playing field for business owners who need stable, reliable staffing solutions. And because, as I said before, we're HIPAA compliant, our healthcare clients and all types of business at this stage care about privacy, and privacy really does matter. And they can trust, and we're solving the problem with this. In this webinar, we'll cover how to hire, train, and most importantly, retain highly effective virtual assistants who are engaged, motivated, and aligned with your company's goals, because that's exactly what you're looking for. So I guess at this point, let's dive in and let's learn about how we find these staff members for you, train them, retain them for you, so you have that continuity you're looking for. So Nathan, why don't you walk us through this?
Yeah, wonderful. Thanks, Mike. And I'm so excited that you're a part of this webinar with us. Mike, so many people, they learn to be successful through models, through other people. And John Maxwell, so much so, did a study. John Maxwell, he's the author of 21 Irrefutable Laws of Leadership, 15 Valuable Laws of Growth, Everybody Communicates, Few Connects. He's written like 90 plus leadership books. But he did a study on how successful people think. And what he found was that when you're a successful person, you participate in something called change thinking. You have to change and adapt with the market. So how do you do that? Well, first he says change thinking isn't automatic. It's not going to happen automatically. You have to consciously sit down like you're doing today. You're watching this live with us right now, or you're watching this webinar on replay, and you have to consciously make the choice. Something's not working. I need to define what it is and make a change. Secondly, change thinking is difficult. It is the hard work of work. The thinking part of work is the part that you can't be replaced of. You have to think through what needs to be done, what changes need to happen. And so the change thinking is difficult. That is the difficult work. But therefore, because it's the most difficult work, change thinking is worth the investment. And we're going to find out how the market has shifted today, how healthcare practices across the United States are doing things differently. I want you to imagine something for me. Just take a second. We're going to get into all the content. You're going to learn about Snapscale. You're going to learn about what we do, but take a second to think about this. I want you to imagine a healthcare practice where every part of your administrative workflow runs like a well-oiled machine, allowing you to focus on delivering exceptional patient care. I want you to think about things like seamless scheduling, okay? Think about your schedule where there's no overlaps, there's no cancellations, rebooks get done immediately, follow-up appointments are set automatically. Think about the concept of a streamlined calendar management, okay? Your schedule's running like clockwork, and it's freeing you and your staff from endless phone calls and all kinds of other things. I want you to think about an environment of effective patient communication. This is communication where the patients get phone calls that are confirmation phone calls. They're not missed. The follow-ups happen. Everything's happening professionally. I want you to think about maybe the potential for bilingual support, not just somebody that can call and speak with your patients, but somebody that can speak the patient's language. Think about reduced administrative workload, no more insurance verification headaches, EMR updates without delays. Think about a freed, cored-up team. I want you to also consider a number of other things. Consider lowering your costs. Consider a practice where improved patient workflow happens. And think about this from an everyday opportunity for a better supported internal team. Okay, this is what we're talking about when we're talking about Snapscale. We're talking about addressing workflow gaps. We're talking about greater peace of mind. We're talking about a clinic of exceptional patient care. If you can imagine that future, then you can model what other successful practices have done, and that is success principle number one. People who Snapscale model successful people and practices. So how do you get to this ideal vision of your clinic? I know that Henry Ford said this, and so I thought it was important to bring it to everybody. Whether you think you can or you think you can't, you're right. And so can you make the shift to the model of a HIPAA compliant healthcare virtual assistant being able to help you and support your practice. I know you might have this thought running through your head right now. Well, virtual assistants aren't cost effective. You've heard nightmare stories, or you've heard other people who've tried certain things, and it's just not financially feasible for you. Well, consider these things before clicking off of the webinar, okay? Consider this. What are the current challenges you have when it comes to attracting and retaining top talent? I think that if you just look at the research, 63% of recruiters say that talent shortages is their biggest problem. So that's recruiters. 76% of hiring managers admit that attracting the right candidate to the job is their greatest challenge. And 9 out of 10 employers are struggling just to fill jobs. The research also shows us that 70% of job seekers are passively looking. They're not actively looking in the United States. Thus, attracting top talent has become more difficult, according to 81% of recruiters, and entry-level positions are the hardest to fill, according to 41% of healthcare companies. So what does that leave you with? That leaves you in this situation where not only is it difficult to find these people, but across the United States, you can see article after article where minimum wage is continuing to increase, thus making it even that much more difficult to find affordable, top performing employees inside of your organization. In fact, we did a deep dive study, and we were following this California Senate bill. Are you guys familiar with this? Bill 525? Which is increasing healthcare salaries for thousands, if not hundreds of thousands of employee organizations and government-funded hospitals to $25 an hour. There's a number of different articles that you could go online right now on LinkedIn. If you're watching this on LinkedIn or on replay and you're connected with me, there's an article that one of our staff members wrote, Alex Corrigan. Number 6, California versus private practice. Look it up on LinkedIn. Or how about why now is the time for clinics to hire virtual assistants? Those are all deep dive articles in this California Senate Bill 525, if that's something of interest to you guys. But it's not just us. Even Call Matters, okay? Call Matters came out with this article and said that workers will reach $25 an hour pay over a number of years, some sooner in different states. Okay, so this is happening, coming to a state near you. How do you find effective staff members that are affordable? So you say to yourself, okay, well, if I have a good hiring practices, then this is going to lead to better quality hires, higher retention rate, and increased productivity and profitability. I want you to stretch your imagination right now. I want you to think outside of the United States. What if you had good hiring practices outside of the United States and you could utilize cost-effective strategies to find the right people, okay, in your hiring practices, hire the right person, then put retention practices in place with good company culture? If you can imagine that, now consider the old ways that you had to go through to hire just in general. This is what you had to take your time to do. This is what you invested in, right? You invested your time in job fairs. You remember that? You used to go set up the little table, try to get people's resumes and interviews at different job fairs. You can hire that way. I don't know that it's effective use of your time, highest best use of your time or your staff's time. How about this? Print media. You can go out into print media. You can spend thousands of dollars in print media or social media. You can go on job boards. You can use traditional-based recruiters. However, traditional-based recruiters, 25 to 30% of the annual salary of somebody that you're trying to bring on board with you. Or you can try to do this on your own. You can go look at Upwork or different organizations like that to find your virtual assistant. That's the old way of hiring. Okay, guys? These are not cost-effective ways. In addition to the problem with hiring, you also have the problem of marketing the role that costs you. You have unproductive staff while the role is vacant. You have a training period that you're spending lots of time and resources on. You have potential for lost revenue. You have a likelihood of miscommunication or potential underperformance. And in a lot of cases, if you have high turnover, you also have high absenteeism going on inside of your practice. That's the problem. You guys want to know what the solution is? It's Snapscale. Just straight to you as best as I can deliver this, the most kind way I can deliver this information to you. Remember, successful practices model other successful practices. And the ones that are Snapscaling, here's what they're doing. We review the resumes, we help match candidates, and then we provide you a video interview of the best candidates for your practice. You're not doing any of the research work. We're identifying those people. Then Snapscale is also going to help you by participating in managing the staff, tracking the time. Then we're going to provide in assisting on documentation and training of those particular staff members as you bring them on board, so that as we bring on new people, the processes and procedures are already documented so you can scale. And then we're going to help you track performance. I'm going to show you how the new companies are all doing this across the United States if they have a healthcare practice and they're doing it in a HIPAA compliant way. Okay. Now, I would be remiss if I didn't take a second to talk about Snap Assist. This is an additional level of coverage. This is above and beyond Snapscale just providing the staff member, managing them, and tracking their time. Mike, I want to bring you back in to talk about our new program, Snap Assist, and how this is going to be beneficial for thousands and thousands of healthcare clinics across the United States.
Yeah, thanks, Nathan. I mentioned in my opening remarks that continuity is a big thing that we're selling to our clients and doctors and whatnot. And to do that is tough, right? I mean, if you find a staff member for your clinic that you think will work, and you bring them in and they're working, just because they're, in the Philippines or in India, doesn't mean that they don't get sick, doesn't mean that they don't, have a family issue that could take them out of work. It happens less than it does, domestically, but it still happens. So, as much as you are only contracting for the set amount of people that you have, we wanted to try to find a way to provide continuity for you if you had an issue with the staff member. And we did that by putting together this program called Snap Assist, which is a level of assistance if somebody has an issue. Those people are working side by side with your staff members to learn how to do the job if they are out. And they learn the core elements of the day-to-day work that your clinic does. And in case they are out, these people will fill in the gaps during the time that they're out. Now, the thing with Snap Assist is they're not your main person, but they train alongside with them. So when they are out, they can handle a good majority of the day-to-day work that person does. So unlike hiring someone domestically and you're in your clinic, you're getting that redundancy through Snapscale that you wouldn't otherwise through this assist program. And it has been a great way to provide that continuity that doesn't happen with, a lot of our other competitors, most of them actually, that just say, okay, here's your two people, and if they're out, tough luck. So we found a way that it works for everybody to provide this continuity of service in the event that someone does call out of work.
Mike, so many times the reason that somebody also can bring in a virtual assistant is just to have a backup for their own staff, right? Their own local staff. Now, this provides a level of support beyond just the backup to the backup. This is like good redundancy in business, but where they're not paying any extra for this. This is included as part of a program to make sure that they have continuity in their business, isn't it?
Correct. So for just to give more concrete examples, so what usually happens with the Snap Assist program, and it is customized based on the clinic. They need to find out what works best for them. Is we really identify what are the core pieces that this person's doing, and we agree to that is what's going to be the backup, right? So if a majority of really what they need to do is do verification of benefits, like we will make sure that person is able to take over with verification of benefits. If it's verification of benefits and it's patient confirmations, like we will do as much as we possibly can in order to provide not you, Nathan, you work here, but to provide the clients with as much continuity as works for both of us.
Think about that, guys. So when you work with Snapscale, you're working with an organization that not only are we providing the resource and helping manage the resource and the things that we talked about. But you also have an organization that's helping you with business continuity. I've never heard that done before. And what an amazing organization we're putting together here at Snapscale to make sure that there's continuity in your business. And speaking of continuity, even if you have a larger call center, guys, let's say that you already, you've already hired 15 local reps, but you can't find any more. You need something to integrate seamlessly into your call center. Well, we can plug seamlessly into your call center. Snapscale allows you to hire as many or as few number of people as you need in order to scale your operations of your business quickly. Again, we just fit slimly, so right in there for you guys. I want to give you a case study because I don't just want you to take our word for it, right? It's one thing when we say it, but it's another thing when you can see what another practice is doing, utilizing HIPAA-compliant healthcare virtual assistants. And here is Leslie Sherbach. She is with Evergreen Primary Care. She's a board-certified internal medicine for adults 18 plus, primary care physician, okay? Here's what she does. So please excuse me. I'm going to read the slides for you guys for this second, but I want you to understand the entire case study. So Evergreen Primary Care in St. Paul opened its doors in October of 2021, offering the community direct primary care model that was designed to provide affordable, high-quality care without the constraints and complexities of health insurance. So essentially what happens is patients pay a monthly fee directly to the practice, and they can schedule their appointments as they need and enjoy direct communication with an Evergreen doctor, okay? So like most practices, though, the new practice in its early days, Evergreen only had a few patients. So the doctors would handle critical tasks like scheduling appointments or referrals or record requests or prior authorizations to keep costs low. This is what the doctors did. But as the patients increased, the doctors started spending more time on critical tasks, which was slowing the growth of the practice. So here's the thought. There's a problem. It was an immediate solution because although the Evergreen team was aware of offshore virtual assistant services, they had concerns about HIPAA regulations and patient privacy. And so what did they do? Here's what Dr. Sherbach had to say. This kind of practice we envisioned, this is the kind of practice we envisioned. And Snapscale, formerly BBC Global Services, has played a role in helping us achieve that vision. Dr. Sherbach says they're HIPAA compliant, and they helped us find, train, and guide our team, Tess, who has become such a valuable part of the Evergreen family. We're happy with our relationship with Snapscale. Thank you, Dr. Sherbach. I appreciate you providing us the case study because this is a way for you, the clinicians now, to be able to utilize HIPAA-compliant healthcare virtual assistants in your practice, not just off of our word, but other practices that have done it. And I'll give you a couple more case studies before the end of the presentation today. Now, that's what successful people who did is they model other successful practices. Here's what else a success principle for you. People who Snapscale follow the SnapSync process. So you not only have a model of other practices that you can follow and how it integrates, but then here's the process that you follow to ensure that you're hiring and onboarding and retaining long-term HIPAA-compliant healthcare virtual assistants. It's called the Virtual Services Development Life Cycle. Okay, this is coined by Snapscale. The SnapSync process is we have a discovery, a design, a resourcing phase, a deployment phase, a hypercare phase, and an operate and monitor phase. Okay, don't get lost in this. This is called a business process. The reason you want to hire and work with an organization, specifically ours, when it comes to HIPAA-compliant healthcare virtual assistants is we have the process so well defined, we're not going to miss a step. Here's what you do. First, we got to determine who do you need. Then we need to know what your numbers are. So we create what we call a statement of work, and this goes around the tasks that need to be done. Then we resource, and we provide an orientation, a hiring, and a training process for you, the clinic, as we go through the process of onboarding your team member. Then we have seamless integration of that team member that you selected. We deploy support, and then we have transparency and progress all along the way. Let me break this down for you because the SnapSync process is more than just one slide, okay? Leaders who know the way, go the way, and show the way. That's what John Maxwell says, is so we can wrap up how successful people think. You got to know the way, go the way, and show the way. And here's what we're doing. We're showing you the way. But don't have this false belief. Delegating to a virtual assistant means loss of control. Hang in there with me. We're going to answer that for you. Okay. Here's the thought that you're probably having: either delegation fatigue, fear of losing control, lack of remote management skills, integration of anxiety, basically, or uncertain. You're uncertain for the results that you're going to get. We're going to help walk you through that. Here's how. Here's how you maintain control. Okay, guys. Number one, in your discovery call, step one, we're going to go over your goals, needs, and expectations. This will help us lay the framework for step two, which is design. We're going to carefully create a statement of work, what's expected from the responsibilities, the performance metrics, and the desired outcome. The statement of work serves as a foundation to ensure that there's clear expectations and successful metrics. So the statement of work is key after the discovery phase. Now, how do we create a statement of work? This is so important. If you're paying attention or if you're taking notes, this is a good spot to take notes, because if you want to write down what you need before you even get into this conversation with us, this would be the time to do it. Okay. I know we've talked a lot about success, different principles. I get excited about this stuff, but this is where the rubber meets the road and where things really matter. What specific tasks or duties will they be performing? Write them down. You have to physically write it down. So if you're thinking about this right now, start writing down a list of tasks as we're talking. What are your main goals for the role? What are the measurable performance metrics and expectations for the role? What are the skills and requirements that your staff member must have? Then you will have reporting requirements. So how are you going to measure the metrics and performance? What data do you need on a report? And have you developed training and procedures for the role? And lastly, what systems will your new staff need access to? Now, here's the real kicker about this. Isn't that the right way to hire anybody? Is to define that information that you need right up front? So with that said, then we're going to go on to the step three, which is resourcing. During your resourcing phase, you'll have an onboarding, a hiring that will happen, and then we'll start the training process with that team member. So during your orientation, phase one of your orientation of the resourcing phase, you're going to go through and revisit your statement of work and objectives. Our team members are going to get clarity, not just in the U.S. team members that we have on the leadership team that are going to go through this orientation with you, but also our team members in the Philippines and our recruiters, so that we have clear understanding of your statement of work and objectives. Then we're going to confirm how Snapscale is going to help and ensure alignment before we proceed. Once we do that, we move into step 4, deploy, and step 5, hypercare. But this is really phase 3 of the onboarding and training. Here's how it works. We set up communication platforms like the email, phone, CRM, all those types of things. Then we provide training and materials, support materials, and we get that training on this schedule. And then we establish success metrics to monitor the training and your progress. Guys, I hope you're paying attention to the things that our team put together to help you right now, just with hiring. Now, imagine if we have this so well defined in hiring for you, imagine what a good job we do as we walk through this process of finding, securing, and onboarding the right person. See, you can't control people. So don't try to control people. Control your business, right? Control your business in your life. If you can do that, if you can control your business in your life, we can help with the process of making sure we have productive, supported team members who are following through on your checklist, the things that you want. If you don't have your systems documented, the first thing you can do is just make a checklist of the things that you need to do. Then, understanding which tasks can create the checklist for is to understand the job description that we need to create to find the right people. We call this process of going through documenting your systems and starting with the most basic task that you need somebody else to do, the Med2 method. In fact, if you'd like a copy of the Med2 method, you're welcome to reach out, reply to the email that Mike had sent you to invite you to the webinar, and we'd be happy to get you a copy of the Med2 method showing you step-by-step on how this practice works of onboarding your virtual assistant, starting with the most basic task and moving through second task and the third task. But it's really simple. You do the checklist and you start with these tasks, okay? If you can do that, you can get your team member trained and up and going quickly. Now, speaking of up and going quickly with team members, we have another program at Snapscale that's extremely unique to our organization. And I want Mike to talk with you guys and let you know a little bit about what we got coming down the pipe with Snap Academy. Again, first in the world doing something like this. Mike, let's talk about Snap Academy and share with the clinicians that are on the call with us exactly what Snap Academy is.
Yeah, I definitely will. I just want to go back for 1 second and, just and say that everything you just shared, Nathan, boils down to due diligence, right? Like anybody, like what you said in the beginning, right? This is what people should be doing in their own businesses and clinics and that sort of stuff. So really what we're doing is exactly what you would do in your own clinic. But again, we have to do it from an outsourced level. So we have to even be more diligent in our process to ensure that when we get going and the staff member starts, that we can pretty much ensure that it's not going to be a disaster. And that is what this is all about. This whole presentation is really about properly setting yourself up for success. And even if you take everything you see here and put it into your own clinic, you're going to get the same result. It just takes extreme diligence from the beginning, because if the foundation is set up great, then the rest is terrific. If you slack in the beginning and you don't necessarily train the people the right way, or you don't, or we don't probe and get from you the exact things that you need, and we just do what we think you need, then you're going to have to, restructure constantly. This type of due diligence we do in the beginning helps both me and you, because you're looking for us to take away the issues that you're having and find somebody to do this work. So we have to provide that. And this is the only way that we can make sure we are as close to being perfect in the beginning. And if we don't do that, then we're not. So the Snap Academy is just another way for us to get us on the right foot in the beginning. So why we started that is that for the most part, when you hire somebody, you hire them with certain traits, right? They either know your EMR, they have a certain level of competence with verification of benefits, or we find the person that matches to the most part of what your statement of work is, the things you need the person to do. And for the most part, that works out great. The person's competent, they know how to do this sort of stuff. And then the client does what we call a client-led training. And I'm not going to get into it that much, but because I know Nathan says I'm going to go off the reservation here. But the fact is that the client actually teaches the rep the fine-tune part of their clinic in order for them to properly integrate into their culture, right? And we then record that. We put it into a package and a training manual that we give back to the client, and we keep so we can manage that rep and for continuity level later in case they want to add another staff or there's a turnover issue with the staff that's currently there. So that works out great, and that's more than most of the companies do. But what we realized is that a lot of clients are looking for more of to bridge that gap between finding the people that can actually do the work and the training piece, right? So what we started to do is put together with Snap Academy certain components, right? And teaching the staff more to get them closer to being, I know we hate to use the word plug and play because that's not how you should talk about humans, but like more of a plug and play environment where you could take the person, they could do exactly what it is you're looking to do. So with Snap Academy, so what we're working on now is we're doing a lot of different type of components, but one of it is how to take someone that knows how to use prompt EMR, which is just an EMR in the physical therapy space, and that specializes in verification of benefits. So we take people that do that and we highly train them, and we specialize and we highly train them, and we make sure they could do it in a super fast, competitive way to accommodate some of those clinics that come in and say, you know what, Mike, I want somebody that can do that, but they have to really do it quickly because we're very fast moving. So we do that. The other thing that we do in Snap Academy, which is most exciting, is we take people that may not be perfectly trained in a certain EMR, but they have all the other qualifications that we need, right? That they work well with Westerners, that they've worked well with patients in the past, that they speak English perfectly. I mean, we all have accents. I have a New York accent, right? We all have accents, but speak English excellently from an active communication standpoint, are highly educated, and are super organized, but they don't necessarily know how the EMR perfectly works. So what we do is we actually take those people and we make them into the perfect virtual assistant for the doctor, right? So we would take them and we would say, okay, we're going to now take these people that have all these soft skills that we all need and make them experts in prompt EMR on the front end and how to verify benefits also. So we create that perfect healthcare VA to be able to, get into, to be able to work with our clients. So that is really about the Snap Academy, because that does two things. Not only does it like stop us for having to hunt for a specific type of person, but it also takes people that are excellent, that are looking for a job, and provide them a job that they wouldn't necessarily be able to get. And these people that we train, not only are we changing their life, because being a healthcare virtual assistant pays more money than a regular customer service rep for the most part, and we provide better benefits and all that sort of stuff. I know, Nathan, you're going to get into that, but it's really giving them an opportunity that no other company that I know of, don't fact check me, I mean, really does. We invest in these people to turn them into the best virtual assistants for our doctors and our clinicians. It's funny, when I was younger, I always said, I don't want a salesperson that is necessarily an amazing salesperson, right? Because for what I'm looking for, I need someone that can learn my process. Okay. I would want somebody, and this I've done it, that has excellent interpersonal skills, excellent listener, a few other things, and let me teach them my process. And they would do better than possibly somebody that had tons and tons of experience, because they didn't have all of the baggage that came along with maybe some outside influences that they had in the past. So we have, with the Snap Academy, we've said that most of the people that we've trained from the bottom have been better than the people that we would just hire that have this supposedly healthcare training, because they don't have all the baggage associated with it. So as much as we do still hire people with the exact stuff, we've proven that we can really take a lot more of the talent pool that we regularly couldn't do because we weren't thinking and we weren't investing, right, in training, and put them to work for our clients and for them. So it makes everybody happy. Everybody's benefiting from this. And it's been amazing, actually. I'm very, very proud of it. Very proud of it, Nathan.
Yeah, Snap Academy is essentially like, it sounds like, Mike, sort of like a healthcare virtual assistant, HIPAA-compliant certification to be able to do this kind of work, to be able to do this role for healthcare clinics across the United States.
Clients, a lot of clients, they love it. They love, okay, they want to train them. But a lot of the clients are now looking to, don't even want to do that. They don't have to, right? So it's working out great. It's providing more jobs, people that wouldn't have them. It's just wonderful.
I love it. And so that's Snap Academy, guys. So step 6, when we're talking about operating and monitoring, so you've been through the training, they're all the onboarding, all that kind of stuff. Now they're working, right? So they've been through your training process. They've been through our training. They're up and going. But how do you monitor them? Well, here's the important thing. Your virtual assistant isn't just overseen by you. We have a data team, a team lead, and you that are all working to oversee this team member. And so 3 eyes looking at the productivity of the individual employee and their work. And so, we partnered with Impact PT, and we customized these daily reports a number of years ago, and they found it to be fantastic. In fact, we have a core value as our organization, and the core value is skill. It's the ability to efficiently and effectively complete a task. That's how we define skill as a core value. Well, here, this tells you the skill of your employee. How efficiently and effectively are they completing those tasks? And so that's what you get in the monitoring and the ongoing support as you are continuing on with your HIPAA compliant healthcare virtual assistant in the long run after they've been hired, onboarded, and trained. And we've gone through that whole process. In fact, it was so nice. Mark Plonner from Impact PT had this to say about our service whenever we helped establish the scorecard and all that for him. He said, Wormley, that's his healthcare virtual assistant, is able to work independently and rarely has to contact them with questions. This has helped us achieve our vision to provide high quality, unrushed care while growing our practice. So if you're wondering, will I lose control? There's your answer. Okay. Now, success principle number 3. So we've dealt with the aspect of modeling successful behavior. Then we went through the aspect of being able to maintain good systems and practices within your business. And now success principle number 3, people who Snapscale reduce the risk of data breaches and maximize HIPAA compliance. Guys, if you've been waiting to understand how to have a more HIPAA compliant healthcare practice, just this part of the webinar alone will help you in what you're about to go through. So here's the thing though, if you want something in life, Michael Hyatt says this: if you have a clear vision, you will eventually attract the right strategy. If you don't have a clear vision, no strategy will save you. And the reason I thought it was so important to share that with you is you already had a vision or you wouldn't be here. You wouldn't be sitting through this training. You wouldn't be to this part if you didn't have a vision on what you were trying to do with your practice, knowing that things needed to change. But you might have this false belief: a virtual assistant compromises data security. Well, let me share with you what we understand and how important this is to our organization. First and foremost, as a US-based company, HIPAA violations can result in hefty fines and legal penalties and damage organizational reputation. And so we know fines can be anywhere from $50,000 to $1.5 million per year. I don't want that. You don't want that. And so we built an organization to help protect against that. In fact, we're a US-based company with offices in Philippines and in India. Mike, you want to talk a little bit about these offices that we actually have in these locations? They're not contracted with us. We own these offices.
Yeah, I mean that right. We own them because that's the only way I can be comfortable in, saying that we're compliant. Now again, I'm in the U.S. and these places are overseas, so there's always that conversation about how much can you really how much can I really do, right? And that's a conversation. But at the end of the day, we are as compliant as we possibly can. Like Nathan did say, I own and operate all of these centers. They're all mine. We do not broker our centers through anybody. I contracted with everybody, including our security guards, who the last time I was there, I watched as they built more cubes to put cell phones in. One of the things about me is my whole thing is, if I'm going to do something, I'm going to do it right. And when I decided to take on this honor of supporting the healthcare community, the doctors and clinicians, I knew to do it, I had to be compliant. And so, I mean, I already had the companies before, but taking it to the next level, I would never have done this if I didn't have my own offices, because you need that level of control in order to be able to sell a level of security that most of our clients are looking at us for, right? And not only do we do that, but, and I know you're going to speak about this a little bit, is that I employed a third-party audit firm, a HIPAA-compliant audit firm, Digital Compliance, to check me as well, right? Because there's only so much I know, and there's only so much I can keep up with this HIPAA compliance, ever-changing compliance. And they are constantly checking what we're doing. They're checking in with the staff on how they're doing things, and they're monitoring what we do in order to protect me, right? That protects all of our clients. In fact, Matt right now is in a training with our Safe Base Initiative people, just going over compliance on how we properly vet a home office if somebody needs to work from home to make sure it's HIPAA compliant. So going back to the other thing is that, like, in order for this all to work for me and my psyche, because I know I have to, at the end of the day, I'm providing the service and everybody's responsible. Having our own offices is necessary. It just is. So we have, so in answer, we have 2 offices in Cebu. I'm sorry, 2 offices in Davao, Philippines. We have 1 small office in Cebu, and they're doing a lot of the Safe Base Initiative over there too. And we have an office in India as well.
Yeah, amazing, Mike. In fact, we have our digital compliance helped us put together this 13-point no nonsense HIPAA security. And so here is the high level stuff that we do as an organization that we just ensure HIPAA compliance through Snapshield. Here, a firewall is installed to protect against unauthorized intrusion. Virus detection systems were implemented, including a procedure to ensure that virus detection software is maintained and updated. We also use the internet. The use of internet via our network is not permitted for personal use, and all systems require valid ID and password. Users are not permitted to allow the other person or entities or the use of their unique user ID or passwords, smart cards, or other authentication information. I know it's HIPAA, guys. I don't want to lavish any of these points, but I want you to understand this is important to your practice. We make sure that users log off the system before going to lunch, taking breaks, and when they end their shift for the end of the day. All terminals have passwords protected screensavers that are activated after 5 minutes of inactivity, and they automatically log them out of the system after 15 minutes. All users change their passwords at least every 3 months. We also instituted the fact that after 3 unsuccessful attempts to enter a password, the user's ID is suspended, and upon termination, all passwords for employees are immediately changed and deactivated. Also, passwords will be changed immediately in the event of suspected or actual password breach. All mobile phones, this is a big one, are stored in a locker for every single employee of Snapscale that works out of a Davao office or Cebu office. All mobile phones are stored in a locker to prevent unauthorized use. And then the office is locked where the workstations are contained when not in use. And so there's 2 additional points here that are kind of like 13.5. These should be self-explanatory, but we add them in here anyways so that you know we never use personal email accounts or work do personal work on a personal computer. These are company-based assets. And then lastly, we're not keeping clinical data on a personal email account. We make sure that they have a HIPAA-compliant, appropriate email account so that there's no private health information breaches. And then SnapShield also has a requirement of officers. And so there's HIPAA officers. Dave Justice, our chief client officer, is a HIPAA security officer. Amy Cohen is a HIPAA compliance officer. Nick Ancho, who's the operations manager in the Philippines, assists with HIPAA compliance officer. And Albert Yoshida, who's a director of client success, is also our HIPAA technology officer in the Philippines. And so there's a mixture of United States and Philippine-based staff members who are officers around the SnapShield program. So that's what you get. However, you heard Mike say earlier, well, what about these people that work from home? Guys, that's not something to run away from. That is exciting. Snapscale is, I would imagine, I believe we're the first company in the world to properly do a safe base initiative using a third-party auditing company to verify independently that we're HIPAA compliant when we are sourcing from outside of just people who can make it into the office. You want to talk a little bit about safe base initiative? Just a couple minutes, Mike. We've got a lot more to get through.
I brought it up before is, people are, looking to work from home now more than ever. Again, we're HIPAA compliant. Our clients rely on us to provide that level of security. And again, I need to make sure that we do it because it's my company, it's my reputation, it's everybody. But again, the fact is that remote is here, just is. I mean, people want to work remote. They have to work remote sometimes. And how this started was sometimes that there's issues like we had COVID where people had to work from home, right? There's issues where people just can't come in for one reason or another. And we didn't want them to necessarily be off work because that would impede our clients' progress. But we couldn't just have them work from home. This isn't like a basic account. They had to be safe. It had to be compliant. They needed to check the boxes to be HIPAA compliant. So we created this Safe Base initiative, which is literally just the same way when I said due diligence is key to setting up your account, right? It's the same thing with setting up a workspace in their home. And this is Digital Compliance helped us put this together as well. And we have someone that's trained go into the person's house, make sure that everything is checked, all the boxes are checked, that everything is created in line with what makes it HIPAA compliant. All right. And then there are audits that are done on a regular basis to make sure that that workspace is still that same way than where we left them. When they do the initial inspection, they send the client, a picture of the workspace, that there's a certificate that they get, all that sort of stuff. However, because we have to make sure it's that way, we do those audits as well. But again, going to our culture, and I'm not going to be, is that it's important to note that those audits are not just our people going in there trying to find something, right? They don't work from the office where we have a lot of culture. Okay, we have a lot of culture, employee engagements and stuff like that. They work from home. So what we do by coming and doing these audits is not only do we, make sure that their workspace is still compliant and we're not in breach of anything, but we bring them coffee, we bring them food, we see how they're doing, we talk to them about what Snapscale is up to that they haven't been a part of because they're not in the office. So it's really a good way to keep in touch with these people that are remote so they still feel connected. Now, again, for the most part of our requirement is that, if they're having an issue in their home, they have to come to the office. So most of these people are within an hour of the office too. So if they have an issue at home, they pop in, they plug in, and they work. So a lot of these people do come to our employee engagement things, but since they're not in the office every single day, this compliance that we have to do of an audit also allows them to stay engaged with the regular ongoing culture. So it really is a dual purpose. And we had this signed off as a proper HIPAA compliant remote staffing scenario, which I think I'm pretty sure we're the first people to do this in this industry.
HIPAA compliance, our third-party auditing, or digital compliance, our third-party auditing service for the HIPAA compliance within our organization. They have a website, HIPAA-training.com. Okay, so that's why it says here, HIPAA-training.com just hailed Snapscale, formerly BBC Global Services, as their best example of compliance in this organizational structure. Don't take my word for it. We have another webinar where we actually had digital compliance on, and you're welcome to go watch that HIPAA-compliant webinar that we previously did as BBC Global Services, where they did hail our organization as the best example that they have of this type of organizational digital compliance, HIPAA compliance. All right, so there you have it. You're wondering how do you get a HIPAA compliant healthcare virtual assistant? You have an organization that specializes in it and focuses on it and has an independent audit of their compliance to ensure that they're working within your practice's best interest from data security. Okay, so success principle number 4. We've talked about the model. We've talked all about the practice and the implementation. We've talked all about the compliance. Now, people who Snapscale retain top talent with their culture. How do we retain top talent, guys? How do you retain top talent in your culture? Here's how you do it. First of all, Alan McGinnis from the book Power of Optimism writes this: our attitude towards people determines to a great extent how they react towards us. Here's what I can't control. I can't control how you treat your virtual assistant, but I can control how we treat your virtual assistant. And so let me share with you exactly what BBC Global, now Snapscale, does to help retain your virtual assistant. Here's the false belief, guys, that we have to break. I will experience high turnover. Yeah, you're going to if you hire internally, if you hire in the US for this type of role. In fact, I pulled this off of LinkedIn. There was a survey done, and I was like, oh, this would be perfect for our webinar. If medical receptionist tenure statistics, okay, less than 1 year, 23% turnover. 1 to 2 years, 35% turnover. Within 2 years, you're likely going to see 55% of your employees turnover if you hire locally for this style of role that we can provide HIPAA compliant healthcare virtual assistants to help you with. Sherma, the Society of Human Resource Management, indicates that productivity loss in the U.S. ranges from 22.6% for planned absences to 36.6% for unplanned absences. This is what happens when employees are not engaged in your work. When you don't have the right culture, you can lose significant amount of productivity just due to absence. Remember, we have the Snap Assist program. Harvard Business Review reports that a positive workplace is more successful over time because it increases positive emotions and well-being, which will in turn improve productivity. So I want to share with you now what makes our culture so unique and positive. First and foremost, we lead with our core values. Our organization is built around our core values, and so we take 100% ownership. That's a core value, making sure that your campaign is 100% our responsibility to make sure that we help you get it right. Taking the initiative to bring about positive results. It means not waiting for others to act, but caring about the outcome as much as an owner of the campaign would. Okay. Dependability, the quality of being trustworthy and reliable. Communication, the act of giving and receiving and sharing information at the right time in the right ways. Skill, the ability to effectively and efficiently complete specific tasks. I alluded to that earlier. We take all of that into consideration when we do the Snapscale performance review. So when each employee gets an annual review, and we ask this question of the manager and of the team member, the client performance and attendance. How have they been doing for you? Okay, so that's taken into consideration for their performance reviews. Cultural support. So how are they performing culturally within the organization and team performance? And their annual review is based upon those major components of making sure they're good team members, good people, and good performers. Okay. Then you layer into our culture that we have got the Snapscale benefits package, which is incredible. Healthcare, 12 days of paid time off per year and 12 sick days per year. Monthly allowance for travel and internet, interest-free loans. In the Philippines, there's predatory lenders, and so we have removed that obstacle from our team members by offering interest-free loans. Employee engagement activities, like I'll talk to in just about a second. Financial literacy classes. We offer 13 months of pay, which is incredible that we pay them an additional month, even though we only live in 12-month periods. Accent reduction program, double pay on holidays. We celebrate their individual holidays with them, and we have shuttle services for those in the around the Davao location to be able to get to work. Just amazing benefit package that we have for each Snapscale agent. And then bonuses and incentives. I don't want to go too deep into bonuses and incentives, but I will let Mike talk a little bit about our bonus and incentives and how impactful this has been.
Yeah. So bonuses and incentives are always geared towards how the agent is performing. And that is always based on a couple things. First thing is, are they showing up on time? A big thing is for continuity is that people come to work, they come to work on time, and they do not miss a lot of days. Okay. The other core competency is a core cultural thing is that they're good to their fellow man, right? We look at both of those things, right? That not only are they coming in on time, which satisfies the requirement of the agent of the client, but they're also good to their fellow worker. That works out wonderfully. And based on those things, right, we provide additional bonuses and incentives. Very basic thing, guys. It doesn't have to be anything super sophisticated. I always felt that overcomplicating an incentive scheme, so to speak, people don't understand it. They don't understand what we need. They get lost in it. It's very simple. Come to work, be a good person. You get paid money in addition to your pay, right? Now, when it comes to your review, if you want to get an even better incentive, an even better review, right? When it comes raise time, you show us how you've either made an appreciable change for the client and or for Snapscale. Because that amorphous feeling of how do I get a bonus? How do I get promoted? All that sort of stuff. We're very transparent about it. If you do your job, you do it well, and you're a good person, you can make more than you regularly will in incentives. Now, when it comes to review time, if you show you've done above and beyond for us, we will provide you even more money, even more benefits, and quite possibly a form of a promotion. And our promotions don't necessarily take people out of the campaign. So it's very straightforward on how people know when they come to work for Snapscale, how they can progress positively and negatively. And that's one of the main reasons, Nathan, that we have such a high retention of our staff, is because it's a level playing field. They come in, they know what they're going to make, they know all the benefits they're going to get, and they know how they can progress. They know how they can make more money. They know how they can increase their jobs here, which a lot of companies they're not as transparent about that. And that goes a little bit above and beyond what you said about bonus incentives, but it's very true. Retaining the talent through bonus incentives is true, but it also encompasses the entire life cycle of what they can do in our company, what they can make in our company, what they can learn in our company, how they can proceed and succeed in our company. And to do that benefits our clients, right? Like we always say, we're in the people business. We are. We're in the people business, the employees and the clients. Like we don't say that our people are telemarketers. They're in client service. They are the talent, and we support the talent. And if you want the good talent to stay, what do? You got to incentivize them. You got to provide them bonuses, and you got to make sure they're at a place that they feel comfortable at, that they feel that they're taken care of, that they feel like they're part of something special. And that's exactly what we do day in and day out. And the bonuses, incentives, and all of the other things that you talked about too, all the other benefits that we provide, in addition to a salary that is better than industry norm, is the reason why they stay, and the reason why we have such a high retention rate, which at the end of the day, guys, is why our clients love us, right? We set the campaigns up properly. We probe our clients on what they need, what we could do to make their lives easier. We find the right people, right, to do those things. We train them in different ways that works for them. And when the talent is here, remember to say talent, not telemarketers, are here, we work tirelessly to make sure they feel special. And we incentivize them based on what they're doing to better you, the client, and or us, the company, how they are working with their fellow man. It works as a total program that has been kind of the secret sauce for us, but is absolutely the secret sauce for anybody that wants to do this too, Nathan. This isn't rocket science. It's just proper diligence and taking care of the people that are taking care of you. And a lot of times we see in this industry that a lot of people are forgetting one thing or the other, right? They're either spending a lot of time doing a lot of due diligence, and they're forgetting to take care of the worker. Oh, he's just a telemarketer, right? Or they're taking care of the worker and they're they're glossing over the due diligence, right? Why we're so successful is we manage both of both of those very well. Perfectly would be a lie. There's no perfection in human beings. I'm not perfect. You're not perfect, but we take away everything that can, as much as we can, that will stymie success, if that makes any sense.
Yeah, I mean, you've systemized hiring process and you've systemized a cultural process. That's what you're looking for in a scalable organization that you can partner with, is an organization that can do these things, an organization that has company cultural town halls where we bring all team members onto one team call and we share successes and celebrate each other with cause for applause and additional bonuses and team members of the quarter and all these types of things that keep the team members engaged. They have a high performance club where they're rising above the campaign requirements and going above and beyond the client expectations. That means your KPIs are outperforming those and they're showing up and doing all the things they're supposed to do. They can get additional incentives for. Plus, they can participate then in company cultural engagement activities, things like the 4th of July or Christmas parties or whatever it is that we're doing in the office to make people feel extremely comfortable and exciting. I'll give you one last case study to end up the program today with, and that's Dr. Choi, localized specialist in Pomona, New York. And here's what Dr. Choi's case study says. He says, first, Dr. Choi opened his doors during the pandemic. Second, New York's complex regulatory environments can be costly. And third, there was a recent uptick in inflation that had driven up costs. This, therefore, created pressure to minimize overhead without compromising patient care. So Dr. Choi, he also struggled to find reliable staff at a reasonable cost to support the growth of his practice. He had spent significant time and money in resourcing and hiring and training an assistant who proved to be unreliable. Like you guys, I don't know, you hire the person, you bring them in, you train them, they don't show up to work, whatever. So Dr. Choi was going through the same process as well, okay? Unlike their competitors, Snapscale, formerly BBC Global Services, houses employees in a centralized location. Like we had told you about, Dr. Choi said that they have a concrete operational structural format for training and HIPAA compliance with managers who provide oversight and make sure the tasks were being completed. One specific need he had was a virtual assistant who was bilingual. Dr. Choi, in the community he serves, 70 to 80% of his patients speak Spanish. He was pleasantly surprised when BBC Global found a significant number of candidates from the Philippines who spoke English and Spanish very well. In addition to their productivity and efficiency and high-quality work, Angelo brought to the table his infectious work ethic and team spirit. There has been no office drama, no work-related issues that need to be addressed at Dr. Choi. He keeps our spirits high, myself included, so we maintain a positive and productive work environment and patients are satisfied. The VA helps him keep a positive work environment, guys. That's because the VA comes from a culture of a positive work environment. That's the only way that can happen. The result for Dr. Angelo, the result for Dr. Choi, from Angelo, 250% more appointments. Time to focus on patient growth. Since Angelo started as a healthcare virtual assistant with Dr. Choi, the number of patient appointments had increased from 20 per week to 50 per week. That's a almost 250% increase because Dr. Choi no longer was bogged down with administrative work. He could see more patients and spend more time with patients. Snapscale has been invested in our relationship beyond feeling our daily needs. We have been in constant communication. They've become a partner in our growth, helping us to fully integrate their services to improve how we operate. Snapscale helped him improve how he operates, which allows us to improve our patient care. I'm thrilled to partner. I'm thrilled with the partnership we've built. It's not just Dr. Choi. It's not just Dr. Sherbeck. Carl Kobeck said, Snapscale didn't just provide a solution, they transformed how we operate, making it possible to continue delivering high-quality care without compromising our values or patient experience. Dr. Argawal was looking for partner with BBC Global Services. Now Snapscale has been transformative experience for our clinic. Initially overwhelmed by administrative tasks and facing challenges in maintaining efficient patient care, Snapscale offered them a solution that not just met but exceeded their expectations. So it's not just 1, 2, it's all kinds, hundreds of doctors throughout the United States, soon to be thousands of doctors and clinicians and audiologists and all of the rest, hearing instrument specialists, retail, the whole 9 yards, from coast to coast. If you need additional help, this is the solution. We have recognition. We're going to a bunch of trade shows. If you don't know who we are, if this is your first introduction, come see us at one of the trade shows this year that we're going to be at. With the involvement, the switch from BBC Global Services to Snapscale, we made a commitment to put ourselves in a number of different industries this year just to be a part of the healthcare communities that we are so happy to help you guys serve. This is what we do, guys. Recruit the team member, help manage their work, track their time, report the productivity, accept your vision, and help train for HIPAA compliance and help you with your training. We do all of that as part of the process. Yet there's another testimonial from another clinician who is happy with our service. Okay. Here's the Snapscale difference. No long-term contracts. The Snap Assist program we talked about, Snap Academy, Snap Shield with the HIPAA compliance, staffing in our offices so that we can remain HIPAA compliant outside of the Safe Base initiative that we have. Employee placement guarantees, so there's no charge to find a new replacement if for whatever reason your person doesn't work out. No additional fees beyond the hourly. Offices in India, Philippines, U.S. Outsourcing staffing expert. U.S.-based leadership team and operations staff. That's huge, guys. We're based out of the U.S. and we work with you to integrate international staffing. Okay. The Snapscale difference is over 22 years of this global staffing experience, impressive longevity of the management team. Many of them have been here more than 4 years just on this the executive leadership team. Snapscale's management team lead that you're provided, so you have that team leader that helps oversee the account. Assistance with procedure documentation, recording for future evidence. Integrated leadership model where you get to work directly with your staff. They attend your company meetings, participate as part of your team members, but participate in our culture. Dedicated staff members, utilize your current systems, and we provide you the Snap scorecard for daily reporting. If you're wondering what to do, get out your phone and scan the QR code. That's the next step. And that'll set up a discovery call with a team member who can start that discovery process. If you have any questions, if you need more information about this, you can comment in the chats, but more importantly, just set up the discovery call. And guys, I know that we've come up, we're way over an hour right now. If you have additional questions, please put those in the comments. We will circle back and make sure that all those questions get answered. I don't want to take up too much more of your time. Mike, thank you so much for being a part of the Snapscale webinar that we did today on how to hire, train, and retain effective healthcare virtual assistants.
I appreciate everybody's time.
Thanks, guys. Have a good afternoon.